We are honored to present a new segment on brain health from Panorama and Light Direction Studios, produced and directed by yours truly and Manu Sharma. Presentations are made by doctors and associates of Sunnybrook Hospital and the University of Toronto, Scarborough. Today's segment of Brain Health discusses the importance of stroke risk factors and recognizing symptoms, and is presented by Dr. Rick Schwartz from Sunnybrook Health Sciences Center. To learn more on how you can participate, visit us at panoramatv.ca or lightdirection.ca.
A stroke, we use the term like a heart attack. A stroke is a brain attack. So it's injury to the brain cells, neurons, from a vascular cause, from a problem with blood vessels. So there's two different ways that blood vessels can have problems in the brain. The first is that they can get blocked. So you can have a blood clot blocking the flow of blood, and that causes what's called an ischemic stroke, where not enough oxygen is getting to the brain cells. That accounts for about 85% of all strokes. The other 15% is what's called a hemorrhagic stroke, or a bleeding stroke, where the blood vessel ruptures and you get blood into the brain. So when either of those two things happen, either the blood clot or the rupture of blood vessels causing bleeding, that results in damage to the brain cells. So neuronal injury, those neurons get hurt and die. That's what causes the stroke, and that results in neurological symptoms. And depending on where the blood vessel is in the brain, different parts of the brain have different function. So if the blood vessel that gets blocked supplies the part of the brain that's responsible for speech, people can have difficulty speaking or aphasia. If it supplies the muscles of the face, then they can have dysarthria or slurred speech. They can have weakness of one side of the body or the other, numbness, loss of vision. Usually it's a loss of function of one type or another. So difficulty seeing, difficulty speaking, difficulty moving, difficulty thinking. And these are all the kinds of symptoms that we talk about. And the other thing that's important to realize is that they happen very quickly. That's why we call it a stroke. It happens in an instant. When that blood vessel is blocked or when that blood vessel ruptures, very quickly the neurological symptoms appear. So somebody is normal, and then moments later, or unfortunately sometimes many moments or hours later, they're found with new deficits. If somebody has symptoms of stroke, or what we call TIA, transient ischemic attack, it's like a mini stroke where the symptoms come on but then go away very quickly. They still need to come to hospital to get checked out, because those are warning signs. And people who have symptoms like that are at high risk of having another stroke. And there's lots of things that we can do to lower those risks. And we go looking for causes like atrial fibrillation, but also risk factors like high blood pressure, high cholesterol, and diabetes. Diabetes is a very strong risk factor for having stroke and can affect the small blood vessels in the brain, causing them to block up or bleed. And high blood pressure is actually a risk factor for every cause of stroke. It can increase the risk of blood vessel rupture and the hemorrhagic strokes. It increases the risk of the plaque in the neck or the plaque in the brain that can narrow down arteries or throw pieces off. And it increases the risk of heart problems that can cause things like atrial fibrillation for blood clots to fly off. So smoking obviously is another risk factor, and smoking cessation is really important to lower risk of stroke. But the single biggest thing that individuals can do to reduce their risk of stroke in the future is to make sure that their blood pressure is checked, and that if it's high, it's treated. High blood pressure would be the single most important preventable risk factor. After that, it's things like diet, exercise, obesity, and diabetes that are really, really important risk factors for stroke. And heart disease as well. The two risk factors really all go together.
If you or a loved one are thinking of participating in the future of brain health, please phone 416-480-6100, extension 2317, or email jennifer.bray@sunnybrook.ca. That's jennifer.bray@sunnybrook.ca. If you would like more information, please phone Panorama TV 416-286-8192.